two important. Welcome again. Today we're gonna complete the next stretches that we have learned by learning one stretch for two important muscles, which are the sternocleidomastoid and the scalene muscles. It's not like we haven't done anything with them so far, because actually when we were doing the side stretch in the last video, that was also working in that area, but now we will be specifically stretching these muscles. However, these muscles are extremely sensitive, even more than the others. So more than ever, you please don't hurt yourself. You take the time to stretch. You can even stretch after shower so that you're sure the muscles are warm, but you be very, very aware of what you feel and you don't cause yourself any pain. But before we do the actual stretch, I'd like to show you an additional manipulation, which is the mobilization of the upper ribs. Why that? Because the upper ribs are the lower attachment of the scalene muscles, and you see the problem that we have, which is connected to the upper cross syndrome, is that if the scalene are shortened, well, they will pull on the first and second rib and, kind of move them slightly upwards, which will lead to several compressions here, called thoracic outlet syndrome. But, on the other hand, if I stretch the muscles without replacing the rib, well, they stay shortened. So kind of the both feed each other. And therefore, I find it a good idea to mobilize the upper ribs before we stretch the scalene muscles. Mobilizing the upper ribs is both safe and easy. It's about, if I want to mobilize the right side, I will dive into towards my knee, so that's called a forward flexion, with my right arm in between my legs. So you see, I go with my right arm in between my legs, and if my right arm is in between my legs, I turn my head to the left, and from then on, I just breathe deeply, like. And I can adjust how high or how low I go to see what it feels here and to find the spot where I feel most. And you see, this simple manipulation done on both sides will create a bit of movement specifically in ribs, and that will facilitate the stretch of the scalene muscles. If you're a medical doctor and you have people with suspicions of compressions here or thoracic outlet syndrome, be aware that the first and the second ribs tend to often be out of place, and that creates this pain here around the corner of the shoulder blade. If this type of exercises is not enough to replace the rib, well, that is a rather safe manipulation if you go to a skilled manual therapist. Ask him to check your first and second rib, left and right, and it's a fairly easy click to replace it. Might take 2-3 attempts until it's stable, provided that your patient or yourself has fixed all the causes of forward head posture, but this is often something which is ignored in the treatment process. And now that we have mobilized this crucial area, let's have a look at how we will stretch the scalene and sternocleidomastoid muscles. The position needs to be extremely precise, so I'm going to describe it slowly, but take the time to really feel the impact of every component of that posture. Let's go. To keep your back flat, you're going to bring one foot in direction of your buttocks and then the other. Alright? And then what we're going to do is the following. We're going to stick the collarbones to the floor, but whilst we make sure that the back stays flat. So you see, both the collarbones and the belt are moving and staying in direction of the floor. We're going to open the chest. You see, this is an open position. This is a closed position. Here, your collarbones move forward. Here, they move in direction of the floor. And once you have done all that, you will bring your left ear to your left shoulder. Then you're going to do a rotation to the other side. and then a very small extension. And you feel that you're actually stretching the right side. Yeah? If you want to increase that stretch, the best way is probably to bring your knees a tiny bit to the left, whilst your right hand on the side that you stretch, can crawl a little bit in direction of your feet. And here, you just wait, make sure that your back is flat, and wait for 40 to 60 seconds. So same idea. This is now your turn. You test the stretch, you see how it feels, you see if you want to integrate it in box 1, box 2, box 3. Be aware that the anterior neck muscles are heavily involved in forward head posture. So if, like many people, this is your common posture, definitely it should be at least in box 2, if not box 1.